3 questions you should ask your doctor at your next appointment. Now, doctor's appointments are no fun, as we all know. As far as I can remember, physician is the only person you don't want to go ahead and meet every day in their office. Going to a physician usually means either you're in pain, or you're worried about your health, or you have a very big problem to take care of. But what is very important is what you ask your physician. So, here are the 3 questions you should ask your physician at your next appointment. Number 1, why is this specific exam or blood test being done? Now, you have the full right to ask your physician. If you see a blood exam or you see a specific exam that you're not sure of, go ahead and make sure you ask them that what is the reason that this test is being done today. Your physician has the responsibility to answer you back. Now, once you get the blood reports back, or once you get the test reports back, if they're normal, well and good. Now, the next question is, if they're not, this is very important for you as a patient to ask that what are the steps that I can take to make this easier. In other words, let's say you got a prescription, right? Prescription is there, medication is there, but it is very important for you to go ahead and ask your physician that, can I do something outside of the prescription to manage my condition better? Or what I'm trying to say is, ask your physician if there are any lifestyle modifications you can make, if there are any smaller changes you can make that will improve your condition, help you manage this specific condition. Now, a very good example is type 2 diabetes. No matter if you are pre-diabetic or you currently have diabetes, exercise will do wonders for you. I'm not saying this is a cure. Again, this is not a medical advice, but if you go ahead and ask your physician, oh, I'm pre-diabetic according to the reports I got, what are the next steps I should do, right? Okay, I'm taking this medication, I'm diabetic. What is in my routine that I should add into? Now, in a perfect world, your physician should have the time to respond back. They should have the time to explain to you what exercise can do for you and what type of exercise to do, when to do it, some basic guidelines. But the reality is, we don't live in a perfect world. So that is why I'm here to help you guys. Coming back to exercise in type 2 diabetes example, we do know that exercise increases your insulin sensitivity up to 96 hours after exercise. If continued over time, you may improve your insulin sensitivity. That means the amount of insulin required to, let's say in simple terms, digest the same amount of glucose or sugars will be way less if you start exercising today. You will improve your insulin sensitivity. Now, what we also know is that exercise can also improve beta cell function in the pancreas. Now, beta cells are basically cells in the pancreas that will secrete and produce insulin. So basically, exercise can improve the health of the cells which are basically producing insulin. And insulin is directly related to diabetes. So this is the whole circle. Number 2 is asking your physician that, am I at risk of developing any medical condition given my family history? A lot of the diseases are based upon genetics. For example, type 2 diabetes, and then there are other blood disorders. Now, typically your physician might not have a clear answer because obviously they might need to do DNA testing. But if both your parents have certain specific diseases, you might be at higher risk of developing that disease. So this is very important for you to go ahead and ask your physician about that. Now, third question is to ask your physician if you should take supplements or not. Now, when I'm talking about supplements, I'm usually talking about from a physician standpoint. That means we're not really talking about performance enhancement supplements as in sports science, but more about multivitamins, multiminerals, so the basic necessities of life. Now, depending upon your blood exam, the physician might want to dig a little deeper, and they might guide you, okay, rather than taking this supplement, let's try to, increase your intake of certain foods, which basically has these minerals or vitamins in it. For example, vitamin D. A lot of individuals, as we age, we are able to absorb or synthesize less amount of vitamin D, so they might need a mega dose or a bigger dose of vitamin D as compared to a very younger population. So these are all the questions for your physicians to decide, but only if you bring this up. As I said, we don't live in a perfect world, but as patients, we can do better, ask more meaningful questions. Your physician should answer and will answer these questions no matter what. Now, bonus question you can ask if your physician is really generous like me is, what are your 2 lifestyle tips? This is not a typical question to ask in a physician's appointment. Now, so go by how you feel, go by what kind of relationship you have with the physician, if you're seeing them for the first time, or if you have been going to them, for a couple of months, years. But usually, this is what I did whenever I would see a patient in my medical practice. I would usually advise them any lifestyle tip which I can figure out from the blood markers, from their, his health history questionnaire, or from what communication I've had with them. So this is again a bonus, but again, as I said, if your physician has the time, they'll be happy to answer this. Now, make sure you bring up these questions to your physician or to your doctor in your next appointment. They might not get answered right away, but they will save you a lot of time, possibly a lot of money, and provide you with good health in the long term. See you guys down the road.